Okay, so yes, I'm a Ph.D. candidate in the Department of Economics at UCLA, and I will be starting at Rand actually in July after finishing my dissertation, hopefully, finally. So I'll be talking to you today about the effects of growth in medical marijuana markets on substance use and abuse. So we've seen these pictures probably a million times, but just to refresh your memory, so marijuana has been illegal at the federal level in the U.S. since 1937, when concerns over the social costs or externalities associated with marijuana use prompted the federal government to place a prohibitive tax on the substance, effectively banning its use and distribution. Now, we're all here pretty much at this summit because the past decades have seen a growing movement at the state level away from such policies of prohibition towards more liberal regimes. So in the 1970s, several states passed decriminalization laws, which removed penalties for the possession of small amounts of marijuana for personal use, but maintained that supply, distribution, and cultivation were still strictly illegal. Then in 1996, California passed the first, what we'll call modern medical marijuana law, which legalized the use of marijuana by qualifying adults for medical purposes, and importantly also established legal protections for the supply and distribution of the substance. As of today, over half of the states in the U.S. have these medical marijuana laws, and several of these states have expanded medical legalization to additionally allow for the commercial sale of marijuana to adults for recreational purposes. Still, despite this growing movement, we have very limited evidence on the consequences of these policies, and this tension between federal prohibition and state liberalization exists largely because of disagreement about the effects of liberalization on marijuana use and abuse, drug driving, and other substance use. So past papers have really looked at these laws quite in depth, but they've mainly used a strategy where they treat medical marijuana laws as a binary variable. You either have it or you don't. And their estimation strategy is to compare outcomes in states before and after medical marijuana law passage to states without such laws. Findings from this have varied from finding increased use to no effects on use to decreased use. But really, the issue with this approach is that it implicitly assumes that there's an equal and immediate effect of these laws on the outcome of interest. Now, work by Rosalie has shown really these laws differ on a number of dimensions, specifically in how they regulated supply. So some states have dispensaries, some states only allow for home cultivation, but these different supply regulations are likely going to have very, very different effects on the structure of the market, the size of the market, and thus on access and price in the legal market. These effects will depend not just on the letter of the law, but also on its implementation. Because implementation is important, we might also not expect the effects of these laws to be immediate, but to have dynamics. So there could be lags in implementation, and these lags are likely not random, but could be correlated with changes in federal enforcement that have occurred over time. So in this paper, because of this issue in using this binary variable, I instead addressed the research question, does growth in the size of legal markets for medical marijuana, as opposed to just the law passage alone, affect non-medical marijuana use and associated health consequences? So just to outline my approach, I collected a new data set that actually a couple papers have come out since I collected this that have used snapshots of this data. But I collected basically data on the number of registered legal medical marijuana patients in each state over time. So a historical state monthly time series of the number of registered patients, which is a measure of the size of the legal market. I show graphically that really there's substantial variation between states in registration rates and within any given state over time, and that these changes in legal market size are largely due to changes in policies that affected production costs in the legal market, and I'll explain that a bit more. Second, I use this new data to show how changes in the legal market size track changes in recreational use. So I estimate the effects of registration rates as opposed to medical marijuana law passage on adolescent and adult marijuana use, allowing for heterogeneous effects because it may be variable. I additionally look at effects on traffic fatalities and substance-related mortality, specifically opioid poisoning deaths and alcohol poisoning deaths. And because I assume there could be very, very different substitution decisions for youths versus adults, I paid particular attention to differences in these outcomes by age. So I'm not going to go through my paper's model, but I'll just briefly identify the key elements of state and federal policy that I predict will affect changes in the legal market. go through my data. I've been told not to show you equations, so I'll probably skip past my empirical approach and just show you the results. I'll show you results for past month marijuana use. I look at past year initiation in the paper as well, but for the sake of time, I'll skip that. Traffic fatalities, alcohol and opioid-related mortality, and then I'll just conclude with summary of findings and limitations. So, in thinking about what drives growth in the legal market, or what would affect registration rates or medical marijuana participation, I focus on two key factors that would affect legal production costs. The first of these is going to be state variation in how strictly producers were regulated. So we can think of, for example, in these strictest states, which I call like self-production states, like Hawaii or Alaska, a patient who qualifies for medical marijuana can either grow a limited one-patient quantity for themselves, or they can designate a caregiver who can grow a limited one-patient quantity for them, but it's a one-to-one ratio. Caregivers are only allowed to serve one patient, and that's kind of capped at a very strict amount that they can grow. You can compare that to a little less strict are the states that had state licensed dispensaries. So here, again, producers can produce for more than one patient, but they were heavily monitored by the state and did have to face production quotas and startup costs such as licensing fees. Then in my laxist production restriction states, such as California and Colorado, here again, patients can grow a limited one-patient quantity for themselves. They can also designate a caregiver to grow on their behalf. The key difference here is caregivers were not limited in how many patients they could serve. So in essence, they could grow a very, very large amount of marijuana. So large-scale production could occur with little oversight from the state. So not only is there state variation in supply restrictions, but there's also been time variation in federal enforcement. So prior to 2009, the federal government was strictly opposed to these medical marijuana law policies and made direct threats in medical marijuana law states that users or suppliers, even if they were compliant with state law, could still be subject to federal prosecution. This changed in October 2009. Well, it changed a bit in March 2009, but it changed formally in October 2009 with the Ogden Memorandum, which was a formal statement by the US government that they were deprioritizing their involvement in medical marijuana law states. So they would no longer prosecute users or producers who are compliant with state law. So this in the model at least is a decline in risk to patients and a decline in production costs for these legal suppliers up to the state imposed limit. This was reversed in June 2011 with the Cole Memorandum when the federal government reprioritized their involvement in these states and ramped up enforcement specifically against large-scale producers. So again, raising the potential cost of production. So basically, to summarize, right, if federal enforcement risk represents a cost to users and or to producers, we would expect that the Ogden Memo should increase the medical marijuana market size. The Cole Memo should decrease medical marijuana market size. And these effects on the supply side should be largest in these states that had very lax restrictions on producers, since costs were shifted over a much broader range of production. If none of that makes sense or we don't care, I can just show you empirically that this holds. So here I'm showing you a snapshot of my data. So all the axes are comparable. This is just a sample of 4 states that I have data for. The y-axis is going to be the percent of adults registered as legal medical marijuana patients. X-axis is time, and these vertical lines represent the date of medical marijuana law enactment in each state. For the top 2 states, Hawaii and New Mexico, these are kind of my stricter production restriction states. And the bottom panel, I have Colorado and Montana, which are my laxer production limit states. So here I'm showing you the pre-Ogden period. And you can see that even with medical marijuana law enactment, there's very little take-up in this legal market. Relatively little compared to when the Ogden Memo occurs. And so here you can see with the passage of the Ogden Memo, there is a slight uptick for New Mexico, these stricter production limit states in registration rates, but it's nothing compared to the exponential growth seen in Colorado and Montana, which is consistent with this story of production costs mattering. The Cole Memo, we would expect the opposite effect, and indeed we find there's maybe a slight decrease in trend in these stricter production limit states in registration rates, but there's actually declines in Colorado and Montana, and I am cheating a little bit with Montana, I should say. At the same time as the Cole Memo, Montana also passed Senate Bill 423, which made, it actually restricted caregivers to only serving 3 patients, and they could no longer receive compensation. And if you look at caregiver counts, they plummet from about 4,000 to about 60. So these supply side factors really matter, and they do drive changes in the patient side of the market as well. And I have a number of robustness checks, but I'm skipping those. So that was a snapshot of my data. I actually did collect this for 16 of these states that had medical marijuana laws during the time period I look at. And again, this is a comprehensive state month time series. So from initial MML enactment up through, at this point I have it through 2014, but my data doesn't extend that far for this paper. The limitations of this are statistics. Well, so okay. I thought this would be easy to get, and anyone who's looked into registration, it's not. These statistics are not maintained similarly across states. So for some states, I got really great administrative records, excellent data. For other states, I did have to do a lot of digging through news sources, archived web pages, bothering state officials consistently. But in the end, I did end up getting this panel, which is a wonderful addition given the limited data we already have on medical marijuana markets, or marijuana markets in general. And it does have a number of strengths. It's a continuous measure that allows for policy dynamics and can account for kind of heterogeneity in market penetration that's been missed by using just a categorical yes medical marijuana law, no medical marijuana law variable. I also use some, like this data on the strictness of state supply restrictions and the timing of federal memos. Again, since I can't show you equations, I'll have to skip past that. And then my outcomes here, which we care about, are marijuana consumption data. This is from the National Survey of Drug Use and Health that we've discussed. It provides state representative data on prevalence of past month use and past year initiation, broken down by age groups 12 to 17, 18 to 25, and 26 and older. That's in the publicly available data set. The restricted level data set, you could probably break it down more finely, but I don't have that. And I'll just show you for this the results for past month use. So again, this is going to be a state year measure. So it's an aggregate data. I don't have the individual level data, but this is a measure of marijuana consumption, kind of the best publicly available data we have. And then for externalities and substitution, I use data on traffic fatalities from the fatal accident reporting system. I have it over a bit longer period. And then I use data from the CDC, the Center for Disease Control, on alcohol and opioid-related poisoning deaths. Again, I'm skipping past how I do everything I do, and I'll just show you results. So I do a number of different specifications and robustness checks. I'm showing you a couple here. Pretty much all the others are similar, but so here, all I'm showing you, right, is my outcome variable here, either for age 12 to 17, 18 to 25, or age 26 plus. It's going to be the share of individuals of the outcome variable, the share of individuals of the relevant age group who report using marijuana in the past month. My independent variable, so my policy variable here, right, is the registration rate, which is the share of adults who are legally registered as medical marijuana law patients. I'm reporting the coefficients from my regression, and so that's saying, and here are the means at the bottom. That 7.2 is just the average. Standard errors in parentheses, and the implied percent changes are in square brackets. So what this is saying, right, is a 1 percentage point increase in the registration rate, which is actually kind of the median registration rate, would increase the prevalence of past month use by 12 to 17-year-olds from 7.2% to about 7.64%, which represents a 6% increase. So a 1 percentage point increase in the registration rate significantly increases past month use by adolescents age 12 to 17 by about 6%. For 18 to 25-year-olds, it's about a 7 to 9% increase. Again, these stars are significant, so they're measured precisely. And then for older adults, it's larger. It's on the order of about 20%. So a 1 percentage point increase in the registration rate results in an increase in about 20% in past month use. Just comparing this, sorry, this is a bit noisy, to past work. So that top line is my registration rate specification. So that's what I did. So the size of the legal market, compare that to a specification that just uses a categorical yes, no medical marijuana law variable. Here I'm comparing two different types of specifications. Not to get too much into it, but all you need to know from this is my registration rate variable, again, it shows like strong, significant effects on past month use for all ages as the legal market expands. As opposed to this medical marijuana law categorical variable, which really kind of flips around depending on your exact specification. So in one specification, it shows a significant increase on adolescent use. In the other, it shows an insignificant decrease. So basically just here, this legal market size is a better measure of when we're thinking about the mechanisms by which these markets affect recreational use. Sorry, I'm running out of time. So I'll show you here, and I don't have tables here, so it's nice. This is going to be a slightly different specification, but again, what I'm plotting here is this is for traffic fatalities. This is going to be for drivers age 15 to 20, drivers age 21 to 24, drivers age 25 to 44, drivers age 45 to 64. I'm plotting the predicted percent change in people they kill, given a 1 percentage point increase in the registration rate. And confidence intervals, again, the precision of my estimate is plotted as these bars. So here you see that for 15 to 20-year-olds, there's a significant increase in traffic fatalities caused by these drivers as the legal market expands. It's positive for these younger adults, but less precisely measured. 0 for kind of older adults. If I restrict this to alcohol-involved traffic fatalities now in the squares, stays significant for these age 15 to 20-year-olds. It's again positive, but not significant for these younger adults. And if anything, it's negative. So negative effects on, I'm out of time, alcohol-involved fatalities for these older adults. This is weekend and nighttime, it's consistent. Here I'm showing that cannabis-involved traffic fatalities go up, but the largest effects for these 15 to 20-year-olds are on accidents where both cannabis was involved and alcohol was involved. And if anything, they're negative effects for these older adults. To dig more into the substitution behavior, these are for poisoning mortality deaths. Again, you can think of these estimates in the same way. If anything, they're positive for 15 to 24-year-olds, nothing for 25 to 44-year-olds, and significant declines in alcohol poisoning deaths for these older adults. Looking at prescription opioids, which are a growing problem, there's large and significant declines in prescription opioid deaths for older adults as the legal market expands. For heroin, they're all negative, but not significant. I'm totally over my time limit, so there's a summary of findings and limitations. I usually have an hour and a half for that presentation.
So our second presentation is Rosalie.
Oh, okay. Sweet.
Our second presentation is whatever.
Okay.
This is Jenny. No, that's Rosanna.
Should I just go again?
You can finish it. You can finish it.
My paper, I should actually set this. It's currently under journal review, so don't worry about it. But
Well, I'm supposed to be the discussant for the session, so why don't I give whatever amount of time is available here to discuss this one paper, which is really a wonderful paper. Rosanna has packed in a whole dissertation into one paper. The downside of that is it's not easy to read, but you can see in here at least 2 excellent papers when she finally gets out of the dissertation mode and starts to see that this is a publishing project. It's not just a paper. The results that you've seen here are really just a sample of a large variety of findings. I mean, they flash by fast enough that I suspect if I asked you, did she include traffic accidents, half of you wouldn't be sure about that. She does. She deals with substitution in one of the most direct ways. The finding on opioid poisonings is really a very important finding because it is the most rigorous study yet of the relationship between marijuana use and opioid poisonings, or at least quasi-legal marijuana use and opioid poisonings. My critical comments focus on one issue really, which is that Rosanna refers to federal policy changes: the Ogden memo and the Cole memo. And given the very compact writing, not a lot is said about what actually the federal government did. The figure I would have put up comes from Rosanna's presentation, and it shows the number of federal marijuana possession arrests and arrests for distribution and production. Okay, so I'll just finish this. The total number of, put aside one bizarre year, 2003, no explanation for this, but from 1996, the beginning of the series, to 2012, the number of federal marijuana possession arrests fell pretty steadily from 300 to 100. Not 300 per million, 100 per million, 300 absolute number to 100 absolute number. There's no sign of any effect of Cole or Ogden there. So let's go to distribution arrests. And there you see essentially a flat series over the entire period. So it would appear that the Ogden and Cole memos are announcement effects. Just a statement that the Ogden memo, remember, back when Ogden announced that they're making very few possession arrests, essentially no possession arrests, and not a lot of production arrests. And now the Deputy Attorney General says, we're not going to make many distributional possession arrests. Well, there doesn't seem to be any news in that, any information. The Cole memo, which said we may in fact be more serious, that potentially could have an announcement effect. That they might have believed, in contrast to everybody else and everybody in the room, that the federal government means what it says when it says it's going to get tough on medical marijuana producers. But I really think that this is, so the idea that it's an announcement effect is implausible. I'm out of time. I had no time. I mean, I can't be out of what I didn't have. Are you
No, well, Jenny's going next.
and yours
Yeah,
yours
it's ready.
So
You're
let me
ready.
just finish this. So the question is, I mean, there's no doubting that the Ogden and Cole memos do seem to have had an effect. But I think that calling it a federal enforcement effect is highly questionable. And the interesting issue then is, well, what is the mechanism involved here? In particular, it might be that the announcement effect is not on the users, but is on local police. So a fanciful way of doing this is the federal government says, oh, we're not going to take this seriously, and the locals say, screw it, we're not going to take it seriously either. And somehow that differs between lax and tight states. I obviously am making this up more or less on the spot, but it suggests that there is something to examine here. It might be, my goodness, that the federal government does have such credibility that when it announces what it's going to do, even if it in fact doesn't do it, that has substantial effects. But I suggest that there's another layer of analysis to do here to follow that up. I yield my time to Jenny Williams from the University of Melbourne.
Thank you very much.
Presentation disappeared.
Thank you very much for having me. This is a bit of a weird paper that is 2-day conference on the broken beer, because it's not actually looking at the effects of a policy. It's stepping back and saying there's been all these policy changes and people are focusing on some immediate potential impacts of the policy, but I'm stepping back and thinking, well, what could some broader and equally important implications be, and what can we learn from the data that's available out there so far? This is joint work with young entrepreneurs from Melbourne and Tilburg. Which one is the, I'm just trying to work out which one does the pointer. Do we have a pointer? Oh, the ball? Sorry, that's technical. I'll just have to wave my arms a lot. Because, I can see a green light coming on, but I don't see anything. All right, well, moving on. Oops.
Can you do it from the machine?
Yeah, it's not moving. I think the battery's dead. All right, so here we go. The screen's not moving. It's not moving, that's not good first. I could rhyme it.
You broke it.
I did.
Oh.
Oh no. Oh, so I was just using you can't use the arrow? Oh, up and down. Yeah, that's what I was doing. All right, here we go. After several false starts. So basically, as we are all very well aware, the legal environment surrounding cannabis has changed dramatically from the US in the past few years. We're all very well aware of that. And what we also should be well aware of is the fact that any impact of these changes in the policy environment is likely to have a large impact on young people. And how do we know that? Well, uptake of cannabis, I'll show you a picture. It typically occurs before 22 or 25. It's highly unlikely to occur after the age of 25. And that's not an American phenomenon. I'm using American data in this analysis. It's true in New Zealand, Australia, the Netherlands, any country you care to look at. So it's important to understand the consequences of these policy changes on young people. In terms of if it affects their cannabis use, how is that going to affect them? And the contribution in this paper is looking at how cannabis use, not policies, but cannabis use, impacts the transition from school or education to work. And to be clear, when I say school, I mean education broadly. So it could be leaving school before finishing high school, it could be leaving school at high school, university, it could be a Ph.D. But I'm looking at the transition from education to the labour market. So this paper specifically focuses on the impact of cannabis use on young men's school-to-work transition. It asks, does cannabis impact this transition? If so, then how and why? So why am I looking at this very narrow point in time when people transition from school to work? Well, if you just look at your high school students, half of male seniors, this is monitoring the future data, half of male seniors have used cannabis in their lifetime. So it's an activity that they've already been engaged in. And in fact, 41% have used in the last year. So it's an activity we know that they engage in. And we also know that initial labour market positions impact heavily on their economic well-being, not only at that proximate point in time, but in fact there's been research that shows that entering the labour market in a bust has longer-term effects, at least to the medium term. So the impact of an activity that may not continue beyond your education can impact you. It could have a long shadow. It could impact you thereafter. Now, in terms of if so, then how, the dimensions we're going to focus on are the duration of time looking for a job between leaving school and starting work, and the wage rate at which you start work. We consider them jointly. And if we do find an effect, we're going to look for mechanisms by which cannabis could affect this transition, and we're going to draw on search theory to help us understand, get our head around what these results mean. So for those of this is the last session, right? So for those of you who are needing a little nap, let's just cut to the chase. I'm going to preview my findings. We find that using cannabis for longer than a year before leaving school reduces the duration of time young males spend searching for a job before they accept a job offer, so they're unemployed for a shorter duration of time, and they accept jobs at a slightly lower wage compared to people who haven't used cannabis at school. If you use use for no more than a year, it has no effect on your labour market transitions. So the findings basically suggest that youthful experimentation with cannabis has no adverse effects on the labour market transitions of young men. But non-experimental use that extends beyond a year, may lead to greater impatience. And I get this term greater impatience from going to our theory and seeing how our results map into our models. It seems to be the case that longer-term cannabis use leads to greater impatience in decision-making with respect to labour market transition. So the idea is people don't want to spend as much time and effort searching, they accept jobs more quickly, they take a wage hit, which may or may not, at first I thought, well, sounds all right, they're less time unemployed, the wage hit's small, but it can have longer-term implications and it's good to be mindful. I want to give you a picture, I'm trying to not have equations, but I want to give you a picture of the model we have in mind. A young man finishes school and he enters unemployment and he begins searching for work. And searching for work is costly, it's unpleasant, it's horrible, you get rejected, you're having to, get into people's doorways, you're having to put yourself forward, it's quite unpleasant. So search is costly, and being unemployed has its benefits. You can get up when you like, you can exercise, you can hang out with your friends. So per period unemployment, people do have a payment of fees, and search is costly. But you engage in search, of course, because it increases the probability of receiving a job offer. You don't get too many job offers unless you get out there and pound the internet, or however one searches jobs these days. So job offers are then characterised by a wage offer. You pound the internet and the pavement, you receive a job offer, you have to decide whether you're going to accept it or not. And wage offers are drawn for some distribution, so there's a bunch of wage offers that you could attract. And the other important thing is wage offers don't depend on your search effort. And individuals have two instruments at their disposal. The first is the effort with which they search for the job, and the second is the policy rule for accepting a job. Basically, they have a number in mind. If I can get this much, I'll take the job. If I can't, if the offer's less, I won't. That's called a reservation wage. The reservation wage is that dividing line. If it's bigger than my reservation wage, I accept. If it's less, I don't accept. But if I don't accept, I have to go search again next period. And I only do that because I think I can get a better wage offer, right?
Correct. In the model, does the period of unemployment reduce your probability of getting an offer or lower the wage?
No.
Okay.
So this is a very simple search theoretic framework. So the idea is, if you want to go out and search again tomorrow, you have to be quite patient because you're getting no payoff. If you decide to accept the job offer, you get a wage. You start working next period. If you don't accept the wage offer, you're out there searching again, hoping for a better wage offer that's going to happen in the future. So you must be patient. So that kind of gives us three different mechanisms by which cannabis use could affect school to work transitions. Through the impatience. If you're more impatient, what happens is you accept jobs more quickly, so your job finding rate goes up, and your reservation wage is smaller, goes down because you're more impatient. Also, it could affect your value of leisure. Cannabis could make you value leisure time more highly because you enjoy, being baked and hanging out with your mates or something, right? So it could increase the value of your leisure time, and that would mean it would increase your reservation wage because you have to compensate me now for a greater value of my leisure time, and also it would reduce your job finding rate because you search less intensely. The opportunity cost of your time is higher. Or it could in fact work through the mean of your expected wage distribution. If you use cannabis at school, it might have affected your grades. So, although you might have graduated from high school, your grades are not very good, and you know that you're not going to get a high wage offer. So these are the sort of, and it also, because your wage offer is lower, you spend less time searching, because there's less of a reward to search. So these are the mechanisms via which cannabis could in fact impact your school to work transition. And if you look at these three mechanisms, they have different predictions for the job finding rate and the wage rate. And so when we look at the impact of cannabis use on these labour market outcomes, the signs that we find in the wage equation and the job finding rate help us distinguish between mechanisms by which cannabis impacts on these transitions. So the data is from the National Longitudinal Survey of Youth, and I know that everyone knows the survey very well, but it's longitudinal data. It's designed to catch people at that transition from education to work. So it's supremely well suited to this task, and it has fantastic annual data on cannabis use. And we're just focusing on males in this paper. I just want to point out a couple of features of the data on this table. First, that 63% of males, I can't find the mouse, 63% of males have ever used cannabis, 43% before they left school, and 49% before they find a job. I'm going to focus on using before leaving school. And the other information I'm going to show you in pictures. I hope you can see this. The top panel is looking at uptake. Your left-hand side is looking at the hazard rate of, so it's looking at the probability of starting use, initiation, conditional on never having used before, so it's initiation. And over on your right-hand side, it's showing you the cumulative proportion of people in this cohort who have started cannabis use, and the x-axis is age. So you can see quite clearly from this diagram, by the time you hit 22, it's pretty flat, there's not much uptake occurring. And see where these steep pointy bits are in the mountain? That's about between 14 and about, I don't know, 19 or 20. That's when uptake occurs. That's when people are completing their education. And so it's all, this is the right time to be, the uptake decision is really salient for the question at hand. On the bottom we have quit rates, and what you can see immediately, this pointy bit, this is the hazard of ceasing use at each duration of use in years. And what you see, there's a big spike at the first year. People experiment with cannabis, 20% use once and that's it, they're done. And then after that there's a fairly kind of wiggly but constant quitting rate of about, I don't know, 5 or 6%. And you can see 20% have quit by 1 year, and in fact, it's about, by about 15 years, 20% are still using, 80% have quit. This is the hazard of finding a job. The dark solid line are cannabis users. So on this side I have hazard, so it's the probability of transitioning, thank you, from unemployment to employment, given that you haven't done so yet, and this is the cumulative probability, so it's adding up. So it goes from 0 to 1. What you can see is the dark heavy line, cannabis users are above the non-cannabis users. They're finding jobs more quickly. This is in the raw data, and you cannot make it go away. Cannabis users find jobs more quickly. This is the starting wage, log of the starting wage, and you can, when I look at those lines, they coincide. I can't see any difference in the starting wage. Now, in terms of modelling, I'm going to use hazard rates to model uptake and quitting of cannabis use, because the dimensions I'm going to be focusing on is cannabis use at school and then duration of use at school, whether it was 1 year or less experimenting or more than 1 year. So I'm using hazard rates to model uptake and quitting, and then transitions into the labour market, so starting a job, and then a linear log wage equation for wages. Now, what's important about the setup is that I allow unobserved heterogeneity from a joint discrete distribution to enter each of the equations, which means I'm accounting for confounding factors. So the analysis uses some tricky econometrics to account for confounding. So I'm going to just, I don't have very much time left, so I'm going to just I'm going to just drop down to panel D. In panel D, what I'm showing you is the impact of duration of use at school for up to 1 year and no more than 1 year on the outcome of job finding, the job finding hazard. So you have the coefficient estimate and the T statistic. So basically you can think that for today's don't ever tell a student I've ever said this, but we're chasing stars. We're looking to see what matters and what doesn't. And then the next column's looking at wages, and we've got the log likelihood and the number of mass points, which is telling you the mass points talk about the unreserved heterogeneity, which I won't go into detail about. But panel D shows you that up to 1 year of cannabis use at school, before you exit your education, there's no stars. So there's no effect on job finding or wages. But you see the hazard rate of exiting unemployment is higher if you use cannabis for more than 1 year, and your starting wage rate, hourly wage rate, is lower if you've used cannabis for more than 1 year. And when we map that back into our mechanisms, that corresponds to an increase in impatience. So you discount the future more heavily. It's not working through your value of leisure, it's not working on a lower expected wage. Now, I don't know how many minutes do I have left? 2. I just want to show you this really quickly. I'm not going to go through, I've got more tables of results. But the analysis, one threat to the analysis is people who don't use cannabis at school, they don't exit, well, people can exit unemployment not just by finding a job. It turns out they can go back to school. And non-cannabis users go back to school more often, or with higher prevalence than people who use cannabis at school. So these longer durations for people who didn't use cannabis at school, it could be because they're not looking for a job and they're going to take a gap year and then go back to school. So I addressed that by looking at returning to school and finding a job as a competing risk. You exit unemployment through either mechanism. I have other sensitivity analysis. In the analysis I've shown you, I just looked at any job. Any job. You transition from unemployment to any job. In the bottom panel, I'm looking at full-time jobs only. So that might be more the school to work transition into if it's an adult role that you're thinking of. And the results are strengthened. I've got some, and the panel D in this table includes the competing risks. So we're modelling returning to school. So I just want to wind up by just summarise, you know, our findings show that experimenting with cannabis while at school has no impact on the school to work transition, but non-experimental use increases the rate at which young men find their first job, and depending on which results you want to focus on, between 13 and 30%, and lowers the wage rate at which a job is accepted by this is the hourly wage rate, by 2 to 3%. And the findings are robust to accounting for a number of different challenges. So what are the implications? They find a job more quickly. Oh, there's a little trade-off with wages, but they're off the street, they're employed, and that's good. Well, that's what I thought at first. I thought, good news story. But then I thought, well, it suggests that experimentation has no adverse effects in terms of labour market transitions, but longer-term cannabis use may lead to greater impatience in decision-making. I'm only looking at the initial labour market experience. What remains unclear, my analysis actually leads to a lot more questions that I can't answer. Does this impatience persist beyond the initial labour market experience? And if it does, what are the long-term consequences of this greater impatience? Does it mean greater job turnover, less investment on the job, so flatter wage profiles, less wage increases over time? We don't know, but I think that they're important questions to consider, and I invite people to do so.
This may be close to the core.
Pardon?
It really wasn't that much going on. Yes. I'm not Priscillia Hunt, and I'm not Jenny, but I'm probably going to show you some interesting data that we've been looking at for the state of Colorado and Oregon predominantly. Basically, the bottom line of this question, I can't read this. You're going to have to do this. 15. Thank you very much. We've seen lots of interesting stories coming out of Colorado, what the implications are of legalization. Rosanna Swartz's presentation was about impacts of medical marijuana laws. We are really interested in this paper to begin to understand what the implications of legalization are. We've had retail stores open in Colorado, as was said earlier this morning, since January 2014, in Washington since July 2014. Don't we have enough data to be able to say something? Wouldn't we like to be able to do so? The bottom line is that there's not a lot of the data that we really care about in terms of the typical harms or typical consequences. I say harms, but in general, there's positive and benefit consequences that we would be interested in looking at. And the problem is, to do that, you need the data systems to have been processed, not just for these states, but for comparative states. And that takes time. Yet, there's lots of interest in knowing the answer sooner rather than later. So, what do? Well, there is information on prices. It has been available more so than some of the other use consequences. And prices, for an economist like myself and my colleague Priscillia Hunt, tell us a lot about what we should expect to change for consumption. Why? Legalization really has two implications for potential use. There's two mechanisms. One, you take away the legal risk. That might make people like me, who are concerned about law, because I come from a family of lawyers, more likely to go ahead and use it because the legal risk now has been removed. That's independent of a change in price. Prices themselves will also influence the amount of consumption I might be willing to do, more or less depending on what's happening to relative prices with legalization. And while there's been lots of evidence suggesting from the experiments that have been going on so far that over a longer period of time, prices will decline with policies, we do not know that about the short-term implications. It's actually theoretically ambiguous, particularly when you're talking about a state like Colorado, which when it transitioned to legalized marijuana, restricted the retailers to be those that were already providing medical marijuana. The number of licensees, entry into the market, was highly restricted until October of 2014 was when it was supposed to be released. It actually happened later. So you have a barrier of new entrants into the market. You don't have competition. That suggests that there's an opportunity for suppliers to do something, especially if demand is changing just because of legalization status. There's the potential for price to go up. It might take time. And so the question is, what happens in the Colorado and Washington experience? That's what we wanted to know. The problem is that we didn't have the ability to do that. I will explain why. But we basically looked at this question using two different types of data. First was household survey data that I'll explain to you. We actually collected proactively before and after the opening of the retail stores in 4 states, Colorado and Washington State, as well as Oregon and New Mexico State. We collected data in 3 ways. I'll give you more details in just a moment. And we compared results from this household data, which is interesting because you're asking people how much they pay no matter where they obtained the marijuana. And we were able to ask for these individuals whether they were buying it for medical purposes or recreational purposes, so we could distinguish the 2 different types of purchases to find out if prices differed before retail stores open and after. And we compare this to web-based dispensary menu data that's been available through the web. Basically, Weedmaps has been posting menu prices for selected convenience sample dispensaries. So there's warts and both sets of data, but the bottom line is we were interested to see, can we tell it, do the different data sources tell us the same thing, or do they tell us something different? Can we learn something from the insights? So the upshot of this is basically, we do not find a statistically significant change in prices in the short run, depending on what you use as your comparison group. And that's really the important story. Washington and Colorado are 2 different states, 2 very different experiences, and you can't pull them together to get a global sense of what's happening to prices in the short run, although long run it might tell the same story. And the reason why, like I said, is heterogeneous experience, but we do see some interesting strain-specific price changes. So let me give you a little bit of background about the data and show you the data before I show you the results. So the household data, like I said, was a household representative, state representative sample in each of these 4 states. It was added onto an existing marketing web-based survey done by GfK Knowledge Group. The problem with the beauty of the data is they go into households, ask them monthly a series of questions. They just added our module on at 3 different points in time. October 2013, no retail stores open. May 2014, retail stores only open in Colorado, and then in October of 2014, only open in Washington. Of course, we have the problem that Oregon was about to legalize, but no stores are technically open for recreational purposes at this point. There's about 2,500 individuals in these 4 states for the household survey. In general, self-reported marijuana use is on the order of about 7% for the entire population, 5% report using medically, 9% report using recreationally, which is how you get the average of 7% in essence. But the number of people who actually report purchasing data is substantially smaller. And in the case of New Mexico, it was 3 people. So we couldn't look at New Mexico at all. We were stuck looking at Colorado, Washington, and Oregon to begin our analysis. So here's the table of just simple descriptive statistics of what we saw wave 1, October 2013, before any stores open, and then wave 2 and 3 are pulling together the May 2014 and October 2014. And you might be concerned about Washington, but I'll tell you, you don't need to be concerned because the trends are exactly as you see here. This is what they report, the average price of marijuana they report, just raw data, per gram of marijuana when they're buying for recreational purposes. Oregon, our control state, did not legalize for recreational purposes, has the lowest average price before anything happens, as compared to Colorado and Washington, which both have, all these states have medical systems, so these are comparable in that regard. The other thing that's interesting, there's some differences in the average units. That might be why Washington's price was a little bit higher. They buy on average smaller units. That's not the full story though there. What's really interesting to me, recreational use where are they getting this from? Where are they purchasing? These are people actually report purchases. And the bottom line is that in places like Oregon, where medical dispensaries were not as widespread necessarily as, say, Colorado, there's some recreational users buying at dispensaries, but it's nowhere near on par of Colorado. Washington's actually quite similar, but Washington had very few collectives because they weren't actually legally protected under state law. Majority of people are buying from friends in Oregon, which is very different from Colorado and Washington. Is that affecting average price? We don't know. The potency is also very interesting across the three states. Average self-reported potency is high qualities. Seems to be similar for Oregon and Washington, and a little bit higher in Colorado, but it changes. So then you also notice in looking at these three waves, you see going from wave 1 to wave 2, 3, generally a price decline except for Washington State, but again, because of compositional changes in where they're buying the average units, it's not really clear that what's driving it. So these are just simple descriptors. Medical marijuana is a little different story. We have that in the case of Colorado, you now have a lower average price reported for people buying in October of 2013 than in Oregon, our control state, and Washington, again, remains significantly higher. Medical marijuana is also interesting. You see here, for the case of Washington, much lower proportion of people buying from a medical dispensary than in even Oregon or Colorado. Is that possibly related to the price that they're having to pay? It's unclear. With just simple descriptive data. We then looked at weed maps data, which we basically had been scraping with funding from the National Institute of Drug Abuse. We've been scraping information from January 1st, 2012, all the way through December 2014. We obtained prices for a number of different quantities based off of their menus, a variety of different products. Because of the large number of products and quantities available through these menus, we had to restrict the sample in a few ways to make it comparable to what we were do in the household survey. Obviously, we shrunk it down to the 3 states that we had data in the survey to compare to. We looked at the 3 months specifically that we were looking at in our survey household data. The difference is we have daily data here in the menus versus survey data. We had what was the amount the last time you bought in the last 30 days, so it was one observation point. We focused on flower material, we dropped edibles and waxes and the like. We were able to look at particular strains that are generally more popular, and we define that by saying the volume that was sold within the menu data. They'll tell you their most popular items. We picked those, and then we reduced extreme outliers and collapsed to dispensary-specific, strain-specific prices. Well, first we do month, yes, by month, for that whole month. Okay, so what I show you here is the average prices first. For each of the strains individually, look, Oregon is in the middle. Our control state, or so we thought, had the lowest average prices even in the medical dispensary at wave 1. And you compare that to Colorado, which is close to Oregon, but slightly higher. And then Washington, which is considerably higher. For both Oregon and Washington, you generally see I shouldn't say, you don't generally see. In the case of Washington, you see a decline in prices in the dispensary reported data between wave 1 and wave 2 in Washington consistently. Oregon, it varies by strain as to what's happening to price. In the case of Colorado, you have the same thing that's happening in Oregon. There's some variability in the impact of price depending on the strain. So what do we do with these data? We're basically going to estimate an average price for each data set based on a series, use a model at a certain point in time. We want to estimate the respondent-specific average price, controlling for characteristics like age, gender, things that might influence their choice, their transaction characteristics, in particular the amount that they were purchasing because of the opportunity for quantity discounts, where they purchased it, which we have in our household data, we do not have in the dispensary data, it's only dispensary sourced, and then we control for a variety of unobserved effects. With the web data, though, we have more specifics. We know exactly which strain was purchased, so we can actually account for strain differences, which is one way of approximating some of the potency. So using these regression analysis, we obtain a predicted average price per bulk gram, and then we look at the differences in the average prices between the treated state, in this case it's going to be Colorado, I was already saying Washington is average higher for medical as well as recreational purposes, where Colorado is more consistent to Oregon. If we pull Colorado and Washington together as treated, which is how we originally wanted to look at it, what you get is that a combination of two different market systems converging over time to a more consistent regional price in the dispensaries. For the 3 states, there's a convergence in the prices across the dispensaries. Is that a function of legalization? These are all the medical shops. It could be a larger supply issue, wholesale issue, independent of legalization prices. So we kept Washington out of it and wanted to look more closely just at Colorado. I've already been told I haven't so many times, so let me tell you the upshot. This is findings from our regression analysis. The way we showed it, we're looking at Colorado 5 months out, which is wave 2, and then about a year out, which was wave 3. When we look at the differences between treatment and control, Colorado versus Oregon, we are not seeing any statistical difference in the beginning. This is for recreational prices. We get some separation in the later waves, but it's not statistically different in terms of the difference between Colorado's changes in prices vis-a-vis Oregon's changes in prices. The general trend is that they're converging. Medical versus recreational, same story, although slightly different signs, but neither are statistically significant. When we look at it in the dispensary level data, we start to see some differences, and in fact, what we start to see is that for the sample overall, there seems to be an increase in prices between October 2013 and May 2014 in Colorado vis-a-vis Oregon. But it's being driven by a couple of strains. And in the paper, what we do is look more closely at, is there something unique about these strains? Happens to turn out that the pushing of these strains, these 2 particular strains, in our later data is much more common than in the earlier data. Is this a response to demand wanting more of these strains, or is it a response to, hey, I can get more money if I sell these strains versus another strain? We can't distinguish in the data. We don't know if this is a true demand effect or a price effect. So lots of limitations with this study. Both data sets have warts. The household survey is limited because it's not necessarily a representative group of buyers. It's highly sensitive to outliers because we have a very small sample. The web-based data has its limitations because it's also a convenience sample of what dispensaries are willing to sell, and it's only the prices that are being observed in dispensaries. We don't have the legal retail outlets, which are the exact same locations in the sample, because we're looking at a period when there are no other legal retail outlets, with the exception of Washington, which I didn't show you this data, so that's not driving this. But you also have the fact that you have non-random choice of what's being put on these menus, and we're only seeing what's on the menus. So, and we're only looking at it compared to one state. Oregon, we would like to look at it with multiple states now that we know that our data using Oregon as a control group is not ideal. Bottom line is we aren't seeing significant impacts of changes in prices in the short run. We have seen data presented by Keaton Miller and others showing a decline over time, much longer periods of time. It's entirely possible that this is a short-term dynamic. But the implication is immediate impact on use might be different in the short run where prices are not declining, as some people have suggested. It might just be a legalization effect. I'm going to have to stop there. So.